In the next slide, welcome. If you have any IT difficulty at all, please chat directly in our chat box, and Alyssa Longi will be assisting you and monitoring the chat box. Next slide. So I'm Karen, and I've been the SME since the last project cycle, and I'll be your host for today. And Marie Zephyr will be the case facilitator. Next slide, please. Just a bit about housekeeping. Please feel free to turn on your videos, mute your microphone, and type any questions you may have in the chat box. Please note, this session will be recorded for educational and quality improvement purposes. Next slide, please. Project ECHO collects registration, participation, questions and answers, chat comments, and poll responses for tele-ECHO programs. Your individual data will be kept confidential. These data may be used for reports, maps, communications, surveys, quality assurance, evaluation, research, and to inform new initiatives. The ECHO session today will be audio and video recorded. Your participation confirms your consent to this recording. Recordings will be used for program quality improvement and potentially future training opportunities. If you are participating via audio or phone only, please announce your name and location and put that information in the chat box for those on Zoom. Next slide. Please note that only the introduction and lecture portions of the presentation will be recorded for educational and quality improvement purposes. No protected health information will be disclosed. All patient information related to the case discussion will be de-identified for presentation during this ECHO session, and only the case ID number, ECHO ID, will be used. And please do not share any protected health information during the ECHO session after Dr. Carlson's lecture. Next slide, please. In the agenda for today, we will be covering first the welcome and housekeeping that we just had, an introduction and icebreaker, the didactic lecture presented by Dr. Carlson, but please do still stay even after we will have the bulk of the session, which would be the case discussion and facilitation by Marie and closing. Next slide, please. NCUI is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. NCUI strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We hold conferences, webinars, and host an interactive website that helps to disseminate information and facilitates partnerships. Next slide, please. We would like to thank the Centers for Disease Control and Prevention for their continued support. Project First Line is a national collaborative led by the CDC to provide infection control training and education to frontline healthcare workers and public health personnel. NCUI is proud to partner with Project First Line. The contents of this program do not necessarily represent the policies of HHC, accreditation, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Next slide, please. Just a quick reminder to complete a survey on today's session so that we can continue to improve our presentations. Here is a QR code that will lead you to the survey, and each of the slides in the lower left-hand corner will have the same QR code that you can scan with your phones and complete as we go through the session. Next slide, please. And here is our survey, just to show how quick and easy it would be to complete in just a few seconds. The questions here that you will be answering would be, would you recommend this training to other colleagues? What did you like best about this session? And what additional information would you like for the future? Next slide, please. Now with our icebreaker, get your cell phones, mobile devices, and computer ready. In the next slide, please. We'll be using Poll Everywhere during this icebreaker, and Alyssa has included the link in the chat box. And in each of these word clouds, you'll be giving your responses live, but they are anonymous. So when you click on the link, you would type in wired sun 334 in order to respond to that activity. If you're using a cell phone, you'll text wire sun 334 to digits 22333 to text your message. And again, for cell phone users who are attending today, you'll text wired sun 334 to digits 22333. And Alyssa has added this information in the chat. And so in our first question here, next slide, please. We'll be doing a test. I'd love to know what are the favorite colors for our audience members here today. And the word that comes up the largest signifies the number of people who have said blue or purple is their favorite color. I'll give a few seconds for everyone to participate and to share their favorite color in this first test word cloud. So I'm seeing blue is at the top. I like teal. I like gray. Anybody else who has not yet gotten a chance to respond?
I didn't think blue was so popular, Karen.
I love turquoise too. I see green and pink and green. Okay.
I thought red would be larger though.
I know. And now,
are people still writing in their favorite colors?
Did everyone get a chance to respond? Please let me know.
I'm resending the information for the folks who just joined.
Okay.
In the chat.
So in the chat box, you'll note that the link for the word cloud for Poll Everywhere is listed, https pollev.com, and you'll type in wired sun 334 in order to respond. If you're a cell phone user, you'll text wired sun 334 to digits 22333. And so far, again, we have blue at the top and purple and teal coming in. Green, turquoise, pink, black, gray, and red. Hey, great. Did everyone get a chance to respond before we move to the next word cloud? Okay. In the next word cloud, and next slide, please. What state are you calling in from? Where are you joining us from? We love to know the attendees here and the areas that are represented. And again, you'll notice that responses are getting bigger if there's a lot more people inputting that particular response. And it looks like Arizona so far is at the head. We see Massachusetts, Connecticut, Georgia, Virginia, California is now taking the lead. Washington, New Mexico, Massachusetts, Kansas, Connecticut, and South Dakota, Virginia, Oklahoma, right? And for those who are just joining in, again, Alyssa will put in the chat box for participation in the word cloud. It is with the link https://pollev.com. And the password would be wiredsun334. If you are participating via cell phone, then it's wiredsun334 to the digits 22333. And the question was, where are you joining from? What state are you representing today? And again, we're seeing Washington, Oklahoma, Massachusetts, Virginia, Florida, Illinois, Kansas, Connecticut, and California is at the head. And I'm reading thumbs up to Washington State. Okay, did everyone get a chance to share their state they're representing today? I'll give just a few more seconds before we go to our last word cloud. Okay. In the next slide, the question is, what are common ways that germs are spread from your vantage point within your organization? And please type either a response or actually an emoji. And so let's have some fun with this. Love to see what pictures, what emojis might be selected to represent your infection control and ways germs are spread. And again, we'll still use that same link, pollev.com, and you'll type in wiredsun334. So I'm seeing doorknobs, phone, I think it's washing hands, or maybe it's frequent washing. Computers, and that's great. In our case facilitation, we'll be having a discussion about that. I think it's frequent hand washing. Chairs, phones. Okay. Workstation, a toilet, I think that's poop. And I guess the monkey who's covering their eyes, is that see no evil? Great. Okay, I see a soccer ball. Okay, I see keyboard, a couple of poops, and hands, and shaking hands. Okay. Switches, PPE, light. Okay. Did everyone get a chance to respond? Any other additions? Okay. Great. Well, thank you so much, everyone, for participating in this icebreaker. Great to know what's on the top of our minds today. Now we will be transitioning to the lecture portion. Next slide. And for the title of this echo session, we'll be understanding how germs spread from the healthcare environment reservoirs and cause harm in healthcare settings. We'll be sharing resources for UIOs and healthcare staff to support risk recognition and understanding of healthcare environment reservoirs. In the next slide, I'd like to introduce our lecturer today. Dr. Abigail Carlson is one of the infection control advisors and subject matter experts for Project First Line with CDC's new training collaboration for healthcare infection control. And she's with the CDC's Division of Healthcare Quality Promotion. And I'm handing this over now to Dr. Carlson for the lecture portion. I just wanted to remind everyone to go ahead and mute their Zoom, and go ahead. You can definitely put yourselves on camera, but go ahead and mute yourself.
Hello, everyone.
Okay, next slide, please. All right, hello everyone. I'm Abby Carlson. As the previous slide said, I am a physician here at the CDC. Just for today, we're going to disclose that I have no financial relationships of any products or services, and I do not intend to discuss any unapproved or investigative uses of products in this presentation. Next slide, please. So today we're going to build off some of the work that you've done in previous echo sessions and dig a little bit deeper into this question of reservoirs in the healthcare environment. Next slide. Briefly going over the agenda, we're going to have a brief review of the things you covered in the last couple of echoes, just so we all are on the same page, and to just give you a chance to refresh your memory on these items. Then we'll get into environmental reservoirs. So we're going to talk about 4 reservoirs in the healthcare environment: water and wet surfaces, dry surfaces, dirt and dust, and devices. And we'll go through each one and talk about the details of each one individually. We're then going to talk a little bit about how each of these reservoirs can be used as you go to discuss your cases here in the next part of the talk. And then finally, we'll conclude with key takeaways and questions. Next slide, please. All right, so first, our brief review. Next slide, please. As you guys discussed last time, and I think the time before as well, reservoirs are a word that we use for any place where a germ lives. There are reservoirs throughout our world, and in particular in healthcare, we focus on 2 sort of large groups: reservoirs in the human body, and then reservoirs in the environment. Next slide, please. Also, as you talked about in your last lecture, germs spread from reservoirs and through reservoirs in a variety of ways. And so we frame this in Project First Line as 5 elements of how germs go from a reservoir through pathways to become an infection by bypassing the body's defenses, surviving through the process, and finding, of course, a person to infect. So these 5 elements are not necessarily linear. They don't go in any particular order, but all 5 have to be present for an infection to happen. So a person has to be present to infect. The reservoir has to exist. There has to be a place that the germ lives and comes from. There has to be a pathway in and out of the reservoir, through the reservoir, to the person for that germ to travel. And in healthcare, those pathways usually break down to 4: touch, breathing things in, bypassing or breaking down the body's defenses, and then splashes and sprays. The body's defenses are multitudinous, so there are many, many different ways your body is designed to protect you from germs, and a bacteria or fungus or virus that wants to, I shouldn't humanize them, that is on a pathway towards your cells to infect your cells, they have to get through, they have to have a way to go past all of the defenses that your body has put up. And in healthcare, obviously, the thing that we often do is we go past those defenses ourselves, either by physically going past them, say, doing a procedure, putting a needle in, cutting open the skin in a surgery, or we break down the defenses in other ways. So, for example, through drugs, immunosuppressants, chemotherapy, steroids, all take their toll on the body's defenses and the ability of the body to stop infections from happening. And then finally, the germ has to survive through this entire process. If it is killed at any point, then it can't cause infection, or if it's otherwise sort of put into stasis, which is what some antibiotics do, they'll just stop the pathogen from multiplying. So this is the model that we use to talk about how infections happen in healthcare. Next slide, please. So to just briefly go through the 4 healthcare environment reservoirs. We have water and wet surfaces. So this includes basically anything that can get wet with water. We're not talking about wet with body fluids so much here. It is more about water itself. But this includes many things that we don't always think about. For example, ice machines, therapy pools, any sink or faucet, showers, bathtubs in the environment, and then drains. We have dry surfaces. So this is actually probably the most prevalent healthcare environment that we encounter on a daily basis. Bed rails, which are the most commonly touched item in the inpatient setting, in a patient room. Door handles, countertops, bed curtains, walls, floors, all of this is considered dry surfaces. And all of these actually have germs. Then we've got dirt and dust. So we're talking about construction, maintenance, repair, and renovation, both inside and outside the facility here. We're not so much talking about, household dust that you dust up with a duster, which is usually just an agglomeration of skin cells and other materials in the environment. We're really talking mostly about things that would contain fungal spores, which usually come from soil and sometimes from construction materials themselves. Then we have devices, and devices is really a catch-all group, and we'll talk a little bit more about that when we get to the more detailed slides. But this can be as simple as your stethoscope and as complex as an artificial hip. It's a catch-all group because there are things that are in devices, but that often kind of what do I want to say? They straddle the boundary, I would say, between a body reservoir and environmental reservoir. And so they don't really belong to either one, but they're most properly thought of as environmental reservoirs when we are talking about infection and disease. All right, next slide, please. So that was an overview of the things that you discussed in the last echo, and the last few echoes. And now we're going to go in more detail about these environmental reservoirs to start building this knowledge that can help you as you try to assess your risk from any given reservoir. Next slide, please. So let's start with water and wet surfaces. Like we said before, water and wet surfaces really exist in the environment in some unanticipated places, but we're mostly talking about water and wet surfaces with water on them or with water soaked into them, not necessarily body fluids. Common activities we think about, these are the most common things you'll see: toileting and showering, cleaning in general, and then hand washing obviously is something that we often will do, and that's a important infection control activity, but it also, you know, generates splashes and gets the environment wet, gets sinks wet, and is important to keep in mind when we talk about a water and wet surface reservoir. Why are we concerned about water and wet surfaces? Well, biofilms is one big one. So biofilms, I kind of like to describe biofilms as the microscopic version of the slime in the sink drain, you know, in your kitchen, where if you open up the drain, there's kind of this slimy coating on the inside of the pipe. That is a biofilm. And these are defenses that bacteria primarily put up to prevent getting killed by other bacteria, by products in the environment, etc. And they can live in those biofilms, and it's very, very hard to kill them underneath a biofilm. And so the best way to kill bacteria under a biofilm is to get rid of the biofilm, or ideally not have it develop in the first place. So biofilms are places where we think of large burdens, large amounts of organisms being, and that's, you know, why it's so important to combat biofilms in healthcare, because we're getting rid of large burdens of organisms. And then aerosols is the other special concern with water and wet surfaces. Aerosols, because water is not sterile, it's safe to drink, it's safe to use on your skin, it's very safe for, you know, most everyday healthy people. But when it comes to the healthcare environment and the things we do in the patients we have, the aerosols of water can carry germs places where we don't intend them to go, or into people who can't fight them off. And so we need to consider, is water being aerosolized? So one great example of this is fountains in the healthcare environment. You'll notice that most hospitals no longer have fountains, water fountains or water fixtures in their facilities. And that is because there's been a series of outbreaks where patients getting treatment like chemotherapy became ill at the healthcare facility due to the water being aerosolized and then carrying germs to people. So this is one of the reasons that there are no there's discouragement of water fixtures in healthcare. It's because of this aerosolization of water that can lead to people getting sick. Bugs that we think about, organisms we think about Acinetobacter, which also can be found on dry surfaces, but likes to live in water. Serratia, when you see, you know, small pink films in like your bathtub if you haven't cleaned it in a long time, or in a particularly humid space that, you know, never dries out if you see it growing on a wall, that pink color comes from a species of Serratia. But the Serratia species that cause people to get infected are not that pink coloring usually, but do also like to live in that wet space and wet environment. You got Pseudomonas, a very, very common one, obviously most concern in causing pneumonia. And then Legionella, of course, gets a lot of attention. Fortunately, it's actually very rare to have Legionella outbreaks in healthcare due to water, but there's a lot of monitoring, and for a good reason. It has happened before, and so this is the one that most people are aware of, but the others are actually more common. Next slide, please. All right, then dry surfaces, our big category that encompasses most of our environment. Anything using touch, any task involving touch often involves a dry surface. Using medical equipment, you can think of a lot of medical equipment as devices, but you can also think of them as dry surfaces. And even the parts that don't touch the body or don't come close to the body are still dry surfaces that should be considered. And then patient transport's another great one you can think about, where all the chairs, the beds, the wheelchairs, the handles, the moving between places that come with patient transport, all of that is kind of moving dry surfaces into interaction with each other. So 3 things, certainly not an exhaustive list. Special considerations for surfaces. High-touch surfaces are a special category that we often talk about. We talk about them needing more cleaning, more disinfection than, every surface in the institution. And that is because that is where hands come in contact with germs. So you think about your door handles, your phones, even to some extent your keyboards, which are classically very difficult to clean. But you also think about bed rails and things close to the patient, things the patient is touching, like call bells, the arm rests of chairs in outpatient settings, for example. And then the other thing about dry surfaces is this is classically a place where things can survive for a very, very long time. So C. difficile has been shown to survive on hospital dry surfaces, particularly floors, for as long as 5 months. In the wild, sort of outside of the healthcare environment, when they've tested it, they have found survival of years. So this is an environment where if it's not cleaned, at least on a regular basis, and disinfected on a regular basis, there are things that can hang out there for a very, very, very long time. Hepatitis B is another one that classically can live on a surface for a very long time, on the order of months. So those are sort of the main high-level concerns about dry surfaces, but their commonality, the fact that they're so prevalent in healthcare, is perhaps the biggest issue. Organisms that you need to worry about on dry surfaces. Norovirus and rotavirus top the list, in part because they transmit so easily. They get on surfaces and stay there so easily, and they are so difficult to kill, particularly norovirus. C. diff, as I mentioned, and then Candida species. So this is fungus, it's yeast. And Candida is all over our skin and all over our environment. But again, in healthcare, we worry about Candida in particular, because it can be very bad when people get Candida fungal infections in their bloodstream, in their wounds, etc. And so Candida is also, like C. diff, very hard to kill because this yeast form is difficult to disinfect. That's not to say that there aren't great products to do the job. You just have to make sure you're using the right product when you're trying to do this. Next slide, please. All right, the dirt and dust reservoir. So again, we're really talking about soil and kind of construction dust, construction material dust, not because the construction materials themselves are the problem, but rather the fungus that tends to grow in places on building materials. And particularly, as you see in the organism list, we're thinking of Aspergillus, which is floating through the air. We all breathe in Aspergillus every day. For most of us, it's not a problem. But if you have a very large burden and somebody who has very sick lungs, you can easily cause Aspergillus infections if you're disturbing too much fungus as you do work. Cryptococcus lives in the soil, and you have the same issue here when you're doing construction and other things that throw a lot of dust into the air. Things that normally most of us don't get sick with suddenly become major issues. So you're thinking of anything that involves construction, renovation, maintenance, anything that kind of involves your facility staff or HVAC staff. That's this reservoir. Concerns, there are two things to just mention. One is that this is really, the biggest issues show up in cancer and transplant units. So this is often less of an issue on the outpatient basis, but especially in primary care, you see people coming in with all sorts of things that you're following in addition to their specialty teams. And so you will have these people walk into your office. And then geography is the other big thing to be aware of. Where you are changes what your risks are with regards to dirt and dust. There's always, Aspergillus and Cryptococcus are pretty universal in the United States. They're found throughout the country and really throughout the world. But there are some fungi, for example, blastomyces or histoplasma or coccidiomycosis, that are only found in certain places. And so being aware of the concerns for your environment is particularly important, so that you know if there's anything special you need to do or be aware of. But in general, you just try to avoid people breathing in dirt and dust from these activities. And a lot of infection prevention and control efforts are focused on containing the air around the activities like this. Next slide, please. So devices, like I said, this is our catch-all category, and we have a lot of examples, but the most common that we could think of, taking vital signs. It's actually devices, the blood pressure cuff, the temperature, the thermometer, the scale, all of those are devices. Starting IVs, so the most common, probably invasive procedure that we do, and then obviously larger things like surgeries. The biggest concerns, shared equipment. So anything that travels between people and is used on multiple people is a risk that is different than those things that are single use. And then using aseptic and sterile techniques. So for a lot of things that we do where we bypass the body's defenses, we have to use special technique in order to kill off the germs that might find their way through those pathways. And so you just want to be very aware of when aseptic or sterile technique is needed as you're doing a procedure. There are many procedures that don't need it, but there are, I would say the majority do. Organisms, really here you're thinking skin organisms, so, and that's represented by staph and strep and candida. Overwhelmingly, those three are the ones you're worried about. However, stool contains so many bacteria that gut organisms are found all over. And so if you think about it, we say there's about 1 trillion bacteria per gram of stool, which is about the size of a paperclip, right? And that gets all over the environment. So devices classically will also cause infections with gut organisms, all of which are mostly killed with routine cleaning and disinfection practices for the device. So the biggest thing about devices is often making sure their cleaning and disinfection is being done as per their instructions for use. All right, next slide, please. All right, so that is the rundown of all the healthcare environment reservoirs. Let's talk for just a moment about how you can use these concepts. Next slide, please. So in the next section, we're going to talk about two separate sets of cases related to the healthcare environment. And we often say that you can use reservoirs to organize your thinking around infection control issues. They are a quick way for you to start asking yourself, what are the risks from the infection from happening? So, first, what reservoirs are present in this space? What reservoirs am I looking at? Am I concerned about organisms associated with dirt and dust? Am I concerned with device organisms? Oops. Sorry, Diane, this might be a pause point. Is the internet, they told me the internet is unstable. Is this, are you guys able to hear me okay still, or is it still unstable?
I can hear you okay now.
I hear you now,
okay.
But
okay.
like the last 30, 45 seconds you cut out.
Okay, all right, so let's go back. Do you want me to go back to bringing it together?
Yes, please.
Okay, sounds good. So do you want to go back one slide and we'll go from there? Okay, so putting it together, we're now going to talk about how we can use these concepts to really organize our thinking when it comes to some of the things we encounter in our work life. and also in this next section of the talk where we're going to go through cases and case discussions. Next slide, please. All right, so the thing at Project First Line that we often thinking, and by that,
Dr. Carlson, you went out again.
Go ahead. Oh, shoot. Can you give me like 20 seconds and I will be able to switch places and get closer to the thing.
We can do that.
Okay.
And I think we can probably just start on this slide because it was right here where it cut out.
Yeah. Did we lose Lamar? Because he's got a bunch of editing.
It looks like he might have left. I'll let him know.
Okay, great. Thanks.
No problem. I was like, is it my computer? Because it keeps cutting out at this exact spot.
It might be the slide.
So I don't know which point this is at.
Okay, I think I'm back and can do this. Let me also just plug in one thing to see if that will help. Oh, one moment. I'm sorry, guys.
Take your time, Dr. Carlson.
At least it happened at the end.
And it's not a live audience, so we're good.
Yeah, exactly. Okay, I'm getting a much better signal now. All right, let's try this again. Let me just give a pause here so that Lamar has a place to cut. All right, so when we talk about using reservoirs, what we're really saying is when you can identify a reservoir, you then can see for yourself what the risks are going to be, or can begin that process of thinking through them. So for example, when you see a device, you think through where that device goes and what kind of organisms live on that device. And by seeing that, you know you have to think through, okay, where does this device go? What does it do? These are the organisms I know that live on devices in general. Have all the right things been done to kill those organisms or stop those organisms through spreading through this device? So you start in a space. In one of these cases, we're talking about the spaces and what they hold. And as you think through that space in this case, think through what reservoirs are in this space. What is here in this healthcare environment that holds germs? And once you've identified the reservoirs, you then go to the pathways and say, okay, how do germs get in and out of this reservoir? How do they travel through this reservoir? And how do they get from these reservoirs to the patient? Are there, is the patient going to touch that? Is the healthcare worker going to use that device? Is the healthcare worker going to use that sink and splash, water? Is there going to be construction in this area? And is that going to be air that the patient might breathe in? And once you think about those pathways, you then go to the action. So now you know where the germs are, how they're going to travel through spaces, and you can ask yourself, well, how do I stop that from happening? Do I need to clean and disinfect something? Do I need to create a construction barrier to hold the air into a specific space? Do I need to make sure that this has been processed as a device, that it has gone through sterile processing so that I can use it for this procedure? What is it that I need to do to stop the germs from getting into this person's body as I do this process? And sometimes that's even, does the person need to be here? So for COVID, we've seen that a lot, where we've said, Things are spreading by being breathed in. One of the things we can do, we just mask up to prevent people from breathing things in. But another thing we can do is simply not have the people come and rather see them by telehealth, or put them in environments where they're not in indoor air that's going to be recirculated, things like that. All right, so this is how we usually approach reservoirs and infection control, linking it all together to get you to a point where you have actions you can take to stop spreading. Next slide, please. All right, just a brief conclusion. Next slide. So reservoirs are one of the factors that lead to the development of an infection, and they're one of the major ones. A germ must be living somewhere in order for it to spread to a human being and cause infection. There are 4 main environmental reservoirs in healthcare where these germs live: water and wet surfaces, and wet surfaces really that are wet with water; dry surfaces, which is the majority of the healthcare environment; dirt and dust, so primarily we're talking about construction and ground dust soil; and then devices, which is a huge category, and a very complex one, but also can be very basic. You can use reservoirs to guide your thinking as you address your infection control challenges and to help you choose actions and prioritize processes. And so they're a great starting place for organizing your thinking. Next slide. And with that, we are going to open the floor for questions.
I'll hand it over now to Marie. Go ahead.
Thank you, Karen, for that nice introduction. Midakapi, our relatives, like she said, my name's Marie, and it's really a pleasure to be here with you today to help facilitate this ECHO discussion. In today's discussion, we'll be examining 2 case studies that present information regarding risk factors that have to do with environmental reservoirs and how healthcare warriors can manage the spread of germs. If we run out of time for both cases, we'll provide you with the second case following this session. These were also emailed prior to the call. Let us now go on and look at those frequently touched portable medical equipment and devices that impact those that work in the healthcare environment. Next slide, please. Okay, and you're at disclosures. Okay, so I fully disclose that as a consultant, none of the tools, resources, or recommendations are proprietary in nature. I also do not discuss information that the CDC nor NACUI has not priorly approved. And I'd just like to apologize for speaking above my elders and know that I'm honored to be here and represent my Tiwahe, as well as help to share information that will make your community a stronger one. Next slide, please. Due to HIPAA, this case discussion will not be recorded. So just a little disclosure there, you're not going to be recorded if you do just decide to participate.